Now I'm going to share with you my life as Michelle Susie Steffens. For the most part, my childhood and early years were a struggle due to a birth defect, constantly feeling sick, and 2 car accidents. My earliest memories were of having an upset stomach and going to the eye doctor for a birth defect that caused me to suppress the vision in my left eye. I was one of those kids whose eyes was turned out and you never knew where they were looking. The eye doctor would place a patch over my right eye trying to force my left eye to see. I remember suffering from intense nausea, irritability, and dizziness throughout my childhood from this. I also found it very difficult to read and play sports, which left me frustrated and self-conscious at a very young age. I also felt sick after drinking milk and eating dairy products, so my parents gave me Carnation instant milk while my older siblings enjoyed the cow's milk. Since my father was a diabetic, we didn't have any sugar or soda in the house, so I usually just drank water. At the age of 16, I was diagnosed with a precancerous melanoma spot on my left knee where I had a scar that didn't heal well from childhood. A surgery to remove the skin large enough to clear the margins was successful, and I've had no further reoccurrence of skin cancer. This was a wake-up call that encouraged me to dramatically improve my diet. At age 18, I underwent my first of 2 eye surgeries to correct the birth defects in the muscles that stabilized my eyes. Because the brain suppressed the vision in my left eye, I continued to see only out of my right eye after the surgery. I then began 4 years of physical therapy to teach my brain how to work with the left eye. Again, I was suffering with intense nausea, dizziness, and frustration caused by the physical therapy. At age 21, I had a second eye surgery on my right eye, and for the first time in my life, I naturally saw out of both eyes and had depth perception. At age 19, I was involved in a car accident where I was rear-ended at an impact of 45 miles per hour. My chin hit the steering wheel and I injured my jawbone. My right foot was on the brake, so I ended up taking the full impact on my right leg and jamming the hip bone into the socket. Immediately, I suffered migraine, headaches, neck pain, and back pain. The MRIs revealed that I had degenerative disc disease that runs in my family. I needed a 6-hour reconstructive jaw surgery, and the surgeon told me I had the jaw joint of a 70-year-old woman, and he had never seen so much degeneration in someone my age. My older brother, 14 years older than me, had already underwent 2 back surgeries, and I could see where I was heading if I didn't figure out why this was happening and what to do about it. I knew I had to make a change or my quality of life would be greatly compromised. I was born in 1969 and grew up before the age of the internet in the 1970s and 80s. I started to visit my local health food store in the early 1990s to read their reference books and learn about supplements that could help my problems. At age 20, I decided to remove sugar, dairy, and most bread products from my diet because I thought it was contributing to the inflammation in my bones and connective tissue. I learned that the antacid medications and proton pump inhibitors I had been on for over 10 years likely caused me to not absorb the minerals in my diet, further contributing to the bone and disc degeneration. With my new diet of low inflammatory foods, the constant stomach pain and acid reflux went away, and I was finally off the digestive medications. I added a few supplements every week until I remember counting 26 capsules daily. But that enabled me to get off all my prescription medications and start to self-heal. I didn't like taking so many supplements, but I was willing to take them as an alternative to the medications I was prescribed. Then at age 25, I was driving down US Highway 19 in Clearwater, Florida at 65 miles an hour when 2 cars flew across the median and hit my SUV head on. I remember the accident so vividly. Time slowed down and I said to myself, why are these cars parking in the median? Oh, they're not parking, they're coming right at me. And then I turned to my son Michael, who was almost 2 years old, sitting in his booster seat next to me, and I remember saying to myself, I think this is the last time I'm ever going to see you. I braced for the impact as to not hit the steering wheel, and I ended up actually bending it back. One of the cars, another SUV like mine, was changing lanes and didn't see the smaller car in his blind spot. Their tires collided, sending both of them spinning out over the raised median. The car I hit was airborne. His right rear tire hit my hood, and I watched it stop just before my windshield. Then it flipped fully and landed upside down right in front of my car. Because the impact was over 100 miles an hour, I suffered a closed head injury that was misdiagnosed at the hospital. My body went into shock, and instantly my blood pressure fluctuated around 140 over 110, with the diastolic number staying over 100 constantly. My heart rate became very irregular, and I could only sleep 3 to 4 hours a night. And even though I was only 25 years old, I suffered with severe hot flashes and night sweats, and now mildly stuttered and stammered, which I had never done before. I had panic attacks every night when I tried to sleep. My body felt as if it was shaking inside 24 hours a day. I couldn't focus. I tried to go back to work after 2 weeks and quickly realized that I could barely function. The neurologist put me on short-term disability and tried a variety of high blood pressure medications, beta blockers, sleeping pills, all of which I responded very poorly to because they were treating my symptoms and didn't realize my pituitary had been damaged. About 4 months after the accident, while on disability, I met an acupuncturist who said to me, I think I can help you. And at this point, I was willing to try anything. In Florida, acupuncture is a covered benefit by insurance, so I was able to receive treatments for a $16 copayment. After just 3 treatments, my blood pressure and heart rate began to stabilize, and I started sleeping better, about 4 to 5 hours a night. And my constant hot flashes and night sweats were reducing. I was able to return to work and felt like my life was somehow going to be okay. After receiving acupuncture for a few months, my progress plateaued and my body recognized I needed another approach. I found another acupuncturist who was trained in China and treated many of the Tampa Bay Buccaneers, as evidenced by the pictures and handwritten thank you notes in his office. His experience in treating head injuries provided me with much relief. I still had all my symptoms, however, they were greatly reduced and manageable. I continued acupuncture every other week for a few years. I enjoyed my career as an accountant, however, it didn't speak to my soul. I decided if I could become an acupuncturist and help others like it helped me, that would be the most rewarding career I could have. At age 29, I decided to quit my well-paying job in lower management and move across the country to go to school to become an acupuncturist. My family thought I was crazy, and my friends were sad to see me go. In 1999, I started at the Midwest College of Acupuncture and Oriental Medicine. I was in the last class taught by Japanese-style practitioners, and I was fortunate enough to learn both the Japanese and Chinese styles. My internship supervisor recommended I take classes with Kiko Matsumoto, the master in palpation-based acupuncture in the US. In my 3rd and final year of acupuncture school, I realized that our school simply taught what was needed to pass the national boards and wasn't enough to provide highly effective treatments. I decided to study with Kiko Matsumoto and Bob Flaws, and I began creating a style that ensured a positive response prior to even inserting the acupuncture needles. After years of always checking and double checking my work as an accountant, it came naturally for me to do the same as an acupuncturist. I relied on feedback from the patient's body to guide the treatment process and ensure lasting benefits. After finishing school in 2002, I moved to Madison, Wisconsin because the community was open to acupuncture and it was a great place to raise a family. Even though I was new to the area, because of my treatment approach, my practice grew quickly from referrals, and within 2 years, my schedule was completely full. After 6 weeks in Madison, I was set up on a blind date with my now husband, Page Buchanan. To find out more about this next phase of my life, please watch the About Michelle Buchanan video.